In today's fast-paced world of healthcare, HMOs face numerous challenges, from managing claims efficiently to enhancing the customer experience. PlateauMed is here to revolutionize the way HMOs operate. Let's get started. At PlateauMed, we believe that dealing with health insurance fraud, waste and abuse and improving enrollee experience requires a well-coordinated technology solution, deliberately designed to link the entire patient journey to the Insurance Central Business Application, CBA. Our hypothesis is that in a majority of cases, fraud does not start from the doctor. A lot of the clinical plan inflation occurs when an individual proceeds to manually enter a pre-authorization request or submit claims to an insurer's portal after the consultation is completed. Therefore, to solve this problem, we have designed an EHR and CBA platform that largely automates this individual's role. Our integrated system uses advanced biometrics to identify enrollees and securely tracks procedures, prescriptions, and investigation requests in real time. We pool data and intervene from the moment the enrollee begins interacting with front desk personnel, through the nurse and doctor encounters, and automatically process large amounts of data which, in an unprecedented solution, we provide to the insurer through our CBA. Neo EHR also ensures that clinicians can view patient data across providers where the enrollee has visited multiple hospitals within the insurer's network, supporting continuity of care and reducing the need for repeated tests or procedures. PlateauMed is currently offering Neo EHR for free to providers, making it possible for the insurer to access these benefits. Within our CBA, we granularly encode benefits. We provide a base of default benefit definitions to a HMO, including over 350,000 diagnoses, investigations and procedures and around 7,000 drugs. These default benefits have been aggregated using tags into logical groups. For example, a group of diagnoses are mapped as primary care diagnoses, and a group of procedures are defined as minor procedures. These default benefit definitions and groupings are flexible and can be amended as required by HMO. The benefits also form the basis of plan definitions and items that are covered or not covered, and of tariffs agreed with providers and which may require pre-authorization or may be concluded without. Adding a new plan benefit will automatically require that it be defined as a benefit first. Our design of the benefits module using PlateauMed links benefits directly to nurses and doctors' notes, comprehensively manages synonyms and ensures that even items not explicitly designed are handled. Our platform robustly handles enrollment directly and through integrations with existing data sources with a health insurer. We utilize data including an enrollee's ID, plan type and expiry dates as well as plan characteristics including limits, wait periods, co-pays and deductibles to smooth a patient's journey in the hospital. Our EHR uses this enrollee data to automate the patient's journey in the hospital. When an enrollee arrives at the hospital, the front desk team is able to search and identify the client using their fingerprint, name, phone number, hospital or insurance ID, among other options. Front desk personnel can add the individual as a new patient and create appointments, or find them in a list of patients with appointments in various clinics. They can view their insurance details, create invoices and manage invoice payments for out-of-pocket patients or co-pays. Neo saves enrollee time as once the enrollee is identified and an appointment is created for them in a clinic, our platform automatically verifies the validity of the patient's plan and limits for the requested appointment. Once automatically verified, the enrollee is automatically passed on to the nurse's screen. To enter clinical data, the nurse simply taps on the card to gain access to the All Inputs screen for outpatient nurses. On this screen, the nurse is able to enter vital signs and is able to optionally specify the measurement site of relevant signs. The nurse is also able to record physical examination findings, as well as record procedures and other clinical notes. Once the nurse has added vital signs, the patient is automatically moved to a waiting doctor and assigned to a doctor. The doctor can review recent clinical entries on the patient encounter timeline across all hospitals the enrollee has visited within the insurer's network, reducing the need for repeated and unnecessary testing, and can use the PlateauMed-based symptom-specific suggestions to record presenting complaints. The platform provides symptom-specific site, character, and association findings for selected symptoms. The doctor can also search or type to enter clinical and differential diagnoses and tap on suggestions to request clinical investigations and procedures. Neo EHR is able to indicate to the doctor whether the enrollee is eligible for the selected investigation or procedure or whether manual pre-authorization is required, automatic pre-authorization granted, or whether the request is likely to exceed the enrollee's limit. To prescribe medication, doctors can search or type in the prescriptions panel, using our database of over 7,000 drugs to find and dose medication, either searching generic names or specific brands. Neo targets waste and abuse in prescribing by providing the doctor with a selection of generic drugs and dosage recommendations based on prescriptions by other doctors in secondary and tertiary facilities in the same specialty to patients of the same age with the same diagnoses. Using these suggestion capsules also saves the doctor time in prescribing. Once the doctor has finished entering their notes, they can review the automatically generated notes and edit the notes and, once done, save the notes. The patient's status is then updated to "Seen Doctor." Any requested clinical investigations and prescriptions are automatically reflected in Neo EHR's pharmacy and laboratory modules, respectively. Neo tracks the status of clinical investigation requests and prescribed medication and indicates to the HMO claims team when samples have been taken, results recorded, and drugs dispensed, reducing the likelihood of fraud. Once the doctor has saved their notes, Neo EHR automatically generates pre-authorization requests for items requiring manual authorization. Upon the hospital finalizing and submitting these to the HMO, Neo provides enriched requests in our contact center module, including the patient's symptoms, diagnoses, chronic conditions, and congenital anomalies. The module also provides how much of the enrollee's limit has been utilized for the benefit category and the last time the enrollee utilized that benefit. Furthermore, Neo Insurer's Contact Center module features a multi-person chat between hospital and insurer staff, automatically generates randomized authorization codes, and displays automatically granted reauthorization. Once an authorization has been granted, Neo automatically notifies the hospital and updates the patient's status to allow for service provision to proceed. Following provision of services, Neo EHR automatically generates claims reports to ease submission by the hospital. With Neo, adding items after service delivery is limited following a specified period, and Neo flags any billing additions made after the patient has left the hospital to the insurer. Once claims are submitted by the hospital, Neo Insurer's claims module flags irregularities in claims in line with preset business rules and indicates the status of every invoiced item for which payment is requested. The module provides any historical chats between hospital and insurer staff to provide context to claims management personnel regarding submitted claims, and provides the insurer access to the patient encounter timeline, giving HMO clinical staff access to the patient's clinical data for case management and removing the need for physical visits to the provider for issue resolution. Neo also gathers feedback on clinical outcomes and service delivery from patients through our patient app, providing this integrated assessment to hospitals and health insurers. PlateauMed is offering Neo free of cost to providers, making it possible for insurers and hospitals to access these benefits. Also, Neo is built on SNOMED and maps to ICD-10, LOINC, RxNorm, and CPT codes, making it possible to integrate with an insurer's existing systems. Join the digital health revolution with Neo Insure and let us help you streamline your operations, improve the customer experience, and automate pre-authorization requests. Feel free to visit these links displayed to view even more resources that you can find helpful, or reach out to our team using the link displayed on your screen.